Let's get ready to play Guess Who? Limited edition.
Does your person walk to work? Is your person frequently seen holding a mason jar? Your person is Rachel. Rachel Cohen.
Wait!
Oh, hey!
Damn it, I'm gonna be late for Baird 5.
Oh, hey, can you come in here for a minute?
Hey Rachel, what's up?
Hey, I just wanted to apologize about this morning. I'm so sorry.
Oh.
I'm so sorry.
No,
I wanted to give you this freshly brewed coffee.
No,
it is really good.
It's
No,
not that.
no, I'm so sorry. And then, like, you know, I was thinking, I had this box of chocolates. It's really good.
No.
You can have this
Really,
too.
it's okay. It's okay.
And let me show you pictures of Asa. Hey.
Oh, hey Rachel, what's up?
Hey, so I was just thinking about what happened this morning, and you know, I am so sorry. And no, so I was thinking you should
It's really- it's not a big
you
deal.
should really take the day off.
So I've got to
And then like I was talking to like people, and we're gonna make sure that this is addressed on a systems basis,
really-
so that we will have things in place so this will never happen again.
Okay.
But really,
it's
and
okay.
do you want an extra week of vacation? We can really do that too. I'll just add that on to the end of the year. You just come in and let us know.
Hi Heather.
Hello.
Mark Schwader.
Utah, home of Salt Lake, Great Salt Lake.
Peter Reed.
Peter Reed. Oregon, home of the Beaver. Not Justin Bieber.
Rachel
Rachel
Milner.
Milner's gonna be a Buckeye. Going to Ohio.
Sean Piper.
Sean, the land of many lakes, Minnesota.
Amelia Fisher.
Malawi, and I don't know the mascot.
Colleen Moran.
Colleen is Wolverine. Colleen the Wolverine.
Allie Furt.
Allie is Rising Chief. Homegirl.
Rachel Cohen.
Rachel Cohen going to Brown. Ivy League.
Is your person a male? Does your person have a soft spot for sci-fi and tween movies? Your person is Sean.
And you have a good night too. Only 2.5 more years on Baird 5. Alright everybody, welcome to your first day of your pediatrics clerkship. I'm Sean Piper, obviously. So, before we get started, I just want to know if there's any topics that you guys would like to cover over the course of your clerkship.
I'm wondering a little bit about sepsis, because I hear that can be a really important topic in pediatrics.
Sepsis is an important topic, but today I'm going to talk about something that's even more important. The Krebs cycle. Now, who here has heard about the Krebs cycle?
Ooh, I have.
Okay, I'm going to need you to calm down. Now in Chicago, they taught us a method to learn the Krebs cycle from the bottom up. Now some very important studies have shown that learning the Krebs cycle through this method increases retention rates upwards of 22 to 23%. Alright, that just about finishes up the Krebs cycle. Now, oh wait a minute. I just got a page from the pathology lab. Okay gang, let's go down and look at some bone marrow slides. In Minnesota, where I'm doing fellowship, they do bone marrow biopsies Q5 minutes. So, let's get on down there. Oh Whitney, did I tell you I only have 10 more night shifts left? Have a great day.
So our next patient is John Smith. He's an 11-year-old on the hospitalist service. He's here with a septic knee, but interestingly enough, he's named after the guy who dated Pocahontas. His family came here.
Okay, we don't need so many details. I have to go to the showing of Twilight this evening, so let's just...
Okay, honey, let's get.
Amelia Fisher.
Quirky.
Okay. Sean Piper.
Oh, Sean.
Last Baird 5 call. Getting stuff from my last NG2 placement ever.
Peter Reed.
Serious.
Rachel Milner.
Smile.
Allie Furch.
Awesome.
Mark Schwader.
Good guy.
Colleen Moran.
Persistence.
Rachel Cohen.
Aw.
Does your person have children? Does your person have chickens? Your person is Peter.
Good afternoon. I am Peter Nathan Tillotson Reed. I am the new AAP president, the youngest in AAP history, and I wanted to talk with you today about the cornerstones of my presidency moving forward. The first cornerstone will be an emphasis on introducing solid foods to infants. According to Wikipedia, baby-led weaning has proven to be an effective way of introducing solid foods to infants. This method is based on the premise that children know their limits. For example, if you give a child an entire turkey leg, they will only eat what they are able, and they will stop when they are full. This is an important point, and it will be a cornerstone of my presidency. The second issue that I would like to bring up today is improving paternity leave. According to Wikipedia, in Sweden, fathers have 16 months of paternity leave. In the US, no paid leave is legally required. This injustice will not stand. By unionizing, residents could better address these issues. Which brings me to my third point. A resident union could increase residents' opportunities for common, everyday, important activities, such as cross-country bike trips with your friends, kitchen remodeling, raising chickens, and of course, quilting. This could be accomplished by a maximum 40-hour work weeks, with call once every other month. All right, guys, it's about 5 o'clock, and it's time for me to get home, a home-cooked meal with some chicken eggs.
Here we go. Peter Reed.
Parental rights. That's what PR stands for. I was thinking advocacy. PR, parental rights. Peter Reed. That's good.
Rachel Milner.
Well, obviously something kitty related. And obviously she's really smart. Can we, what's one word that describes popping a baby out and coming right back to work? Amazing. Efficient. Efficient.
Sean Piper.
The first word that comes to mind when I hear the name Sean Piper is Dynasty, not to be confused with Shady Nasty. I don't think I can compete with that.
Okay. Rachel Cohen.
Nurturing.
Colleen Moran.
I feel like she's a wealth of knowledge about primary care things that I've forgotten.
I feel like she herself is an advocate for the hypothalamic pituitary axis.
Mark Schwader.
Physiology guru, which I appreciate.
As do I. Mark is going to be fine. That's the major thing about Mark. He's going to be a cardiologist and he's going to be fine, which is awesome.
Yes.
Allie Furch.
The first thing that comes to my mind, because she is supposed to be in the PICU this past week, She has not been around, and some of us have had to do her work for her. So,
Like order her genetic testing.
recording testing. Yeah.
Amelia Fisher.
Amelia is an energizer.
And Amelia's like a co-attending. She's the co-attending in my life.
Is your person fellowship bound? Is your person female? Does your person frequent the VFW for bingo? Your person is Rachel Milner. And someday when you grow up, I'll even teach you how to use the potty. Oh, hey guys!
Hi, Rachel.
How are you all?
How are you?
Good. Hi. Oh my gosh, I'm so excited you're all here. Hey,
How are you feeling?
Good. I've missed you guys. Maternity leave is great, but it is so nice to see folks
Yeah.
again. It's been starting to get just a little lonely.
Can
So-
we see baby Charlie?
Of course. Take a look.
Who's that?
Oh wait, did you want to see baby Charlie?
Yeah.
Baby Charlie's sleeping. This is the kidney. We're spending some time together while Charlie's sleeping, just kind of spending a little quality time. Would you guys like to hear all about my friend the kidney?
Sure.
Awesome. Well, kidney is doing wonderful with over 1 million nephrons. Filters almost 2 quarts of urine every single day. Someday you're going to have so many responsibilities, maintaining electrolyte balance, cleaning up metabolic byproducts, all sorts of important roles. You're also going to be responsible for keeping the body calm by maintaining blood pressure and putting out essential hormones. There'll be times where there'll be bumps along the road, but those rocky times won't last. Just a little hydration will help a lot. So kidney is doing wonderful. It's amazing. Yeah.
Okay.
So what's this? Is this some kind of baby bomb?
This? Oh my gosh! Come on guys, you've seen these around the NICU. This is my emergency googly eyes. You guys know what they're there for, right?
No.
Oh my gosh! Well, it allows me to know everything that's happening out on the floors, so I can keep track of all the cool things that are coming in.
Oh, that's how you do it.
Yeah! Like the kid with dysmorphic features and 1 kidney. Potter syndrome may be happening. CKD, I'm on it. Nephrogenic DI, yeah, it happens. All sorts of amazing things going on. More fluids, less fluids, just keeping an eye on what's happening with the kidneys. Can you guys hear that?
No.
Charlie's up!
Oh
my
gosh! We were wondering.
You're gonna get to show him off too.
All
This
right.
is great. After we admire how cute he is, we'll go and we'll take a look and talk about his infant kidneys and how they're different than ours. Let's go, guys! Let's go!
Peter Reed.
Ultimate Frisbee.
Rachel Milner.
Divergent.
John Pfeiffer.
Bagpipes.
Rachel Cohen.
Rachel Cohen. Mockingjay.
Colleen Moran.
Frindle.
Mark Schwader.
Mark Schwader. Bonnie Raitt. Have a heart.
Allie Furch.
Allie Nobel, as in the prize.
Amelia Fisher.
Amelia Fisher. Fetch. Have you ever seen Mean Girls?
Is your person a native Vermonter? Does your person have a black book of knowledge? Your person is Amelia.
Oh, Amelia. So glad
Good
you're
morning.
here.
Good
Good morning. Here you go.
All right. What do we got?
So first up, new patient. We've got a 5-year-old girl named Olivia.
Olivia.
Thought you'd like that. Yeah.
Oh, speaking of which, did you see Scandal last night?
Well, I did watch it. From
Okay,
a
can you
call
catch
room.
me up? Because I didn't get a chance to see it.
Okay, so it starts off Jake's lying flat on a table. You're not
Wait,
sure if he's
what?
dead or alive. I know. Then Huck comes in, he pounds on his
Wait,
chest.
what?
He,
Oh my
it
God.
seems like he's resuscitating him. Yeah, so he comes in, they take him out to like a safe house. I think they're in like Russia.
Wait, what?
It's really cold, ice is all around. Yeah, it's in Russia, I think.
Oh my God.
And then Olivia goes and looks for like a Russian doctor
Wait,
to come and
hold
help.
on, hold on, stop.
Yeah.
What Russian doctor?
I don't know.
No,
She's
what's her name?
me.
Well, okay, what did she look like?
She had feminine features.
Dark hair, light hair?
It was darkish.
Oh, okay, never mind.
Okay.
I'll look it up. Keep going.
Okay. So anyway, she thinks about diagnosis. You mean about Scandal or
No,
Olivia?
about Scandal.
Okay,
About
so
Scandal.
yeah, she comes up. She's like, I think we should do a silver bullet. I think
Wait,
that's
what?
gonna be an antidote.
Oh my
Yeah,
God.
Exactly. So.
Oh, hey Boo Boo. Hey Coco. Hey Hustle. Hey Smalls. Hey Jayco. Okay, keep going.
Okay. All right. Yeah. Okay. So. Anyway, I think he's alive. End of the story. Okay.
Wait, what?
Okay.
Rachel Milner.
Euvolemic.
Peter Reed.
Relaxed.
Mark Schwader.
Confident.
Allie Furch.
Charming.
Colleen Moran.
Cloudy.
Amelia Fisher.
Excited.
Sean Piper.
Fuchsia.
Allie Furch.
Measles.
Sean Piper.
HPV.
Colleen Moran.
Pertussis.
Amelia Fisher.
Tetanus.
Peter Reed.
Mumps.
Rachel Milner.
Hib.
Mark Schwader.
Diphtheria.
Is your person from the South? Does your person ever impersonate a moose? Your person is Allie.
I just has a septic joint, and I really think we should have.
Okay, wow, yeah, all right. Well, I like your commitment to really treating the patient. I think that is great. Now, I think where you were going with this is that you were thinking historically how we have treated septic infections of joints has been amputation. We're thinking like Civil War era. But now, thank goodness to antibiotics, we have IVs. We can just give antibiotics straight in. So I like where your head was, and I think great thought. Keep going.
Whew. You know what? I've got a full day ahead. Start at 4 a.m. on the lake doing my reps, you know. Then I'm going to go run half marathon this morning, half marathon this afternoon, training for an ultra marathon, you know, back down in the bluegrass state. And then I'm going to go write an article, do some research, and I plan on getting a nice long cat nap tonight, 30 minutes, all I need. Do you want to know what we're looking for? I'll tell you. We like enthusiasm and hard workers. If you like leaving work before 5, don't apply. If you liken your spirit animal to a sloth, not interested, all right? And if you like complaining, complain elsewhere, okay? This is the good time gang, okay? And we have a good time out on the lake and in the wards. So, you know where to reach me. I'll be paddling, trying to go for gold, and I hope you'll join me. All right, hit, 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 hit.
Does your person have children? Does your person's significant other cook them gourmet meals for lunch? Your person is Mark.
That's an impressive pericardial friction rub.
Hey Mark, you can hear that? You don't even have your stethoscope.
Of course.
Why does Mark suddenly appear every time an echo's near?
Yes, I'm worried about acute pericarditis.
Oh.
With effusion. Could be caused by a myriad of things, including viral, like Coxsackie, CMV, HSV, bacterial, JIA, Kawasaki, connective tissue disorders. The list just goes on. It's fascinating stuff, don't you think?
That is really fascinating. Oh no, this could be really bad.
Oh, cardiac tamponade. I was afraid of that. Increased intrapericardial pressure causes decreased venous return to the heart, which then causes decreased diastolic filling, which decreases cardiac output. This child's in cardiogenic shock. We need to act quickly.
Okay, what do you need from me?
An 18-gauge angiocath.
Okay, let me get it.
All
Here's
right.
your cath, Dr. Schwader.
Okay. That should do it.
Is the baby okay?
Oh, he's gonna be fine. Normal S1, S2, no murmurs, rubs, or gallops. I think my work is done here.
Nice job.
Shway baby, shway baby,
Shway baby, shway baby,
shway baby, shway baby.
shway baby, shway baby. Oh, hey, Mark.
Oh, hey, Whitney.
How's it going?
Oh, wait. Do you mind holding off for a minute?
Oh, you want a cheese ball?
No. May I?
Oh.
Early systolic ejection cliff. Now, you
What's
should
that
have been
mean?
checked out. Could be a bicuspid aortic valve.
Really?
Yeah.
Sean Piper.
A love. 1980 sweater.
Allie Furch.
Oh, a love.
Fabulous. Snarky, smart. Are the
Snarky.
2 words. Best meatloaf recipe ever from her mom.
Yes.
Okay.
Thank you.
Next up is Mark Schwader.
Heart hand.
Yep. Great guy. Lovely family man.
Lovely family, yep.
Amelia Fisher.
She is a little stinker.
Yes, Barbie hater, which made me really love her a lot and torture her. Mm-hmm.
Peter Reed.
Pita. He makes me think pita, not because he's English, but I know a pita, but he is reserved. Like an Englishman.
He's not as quiet as he used to be. He's
No.
come out of his shell a bit. That's a good thing.
Colleen
Colleen
Moran.
Moran is a love.
Safe reports. And safe reports.
Yeah.
She won.
Oh.
Yes.
Oh,
yes.
yes.
She won the contest.
Well, good.
And now we're shifting gears to Rachel Milner.
Wicked snarky, lovely. Charlie's angel.
She does a
Charlie's
very
angel.
nice little dance. You should ask her to do it
Yes,
for you.
yes, she does a dance.
Snarky is a compliment.
Yes,
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 yes.
Yeah.
absolutely.
Okay. Last but not least, thank you for being so patient, Rachel Cohen.
Rachel,
Are these people all leaving us?
Yes,
Why
I
do you
think
guys do that to
weddings and babies and loveliness.
I love her. I love
Yes,
them all.
We love them all.
Any parting words that you want included in the video?
Don't go. Don't do it.
go. It's silly, but I get homesick for them all, even though they never belong to us. I feel like they're ours, and I miss them when they leave.
Stay in
So
touch
we'll
and
be
good
back.
luck to your future.
Yes.
And if you're in the area, come and visit. Please.
Don't forget
we like
NICU.
visits.
You liked us
And
best.
I'll probably cry.
Yes.
Okay.
Is your person a native Vermonter? Does your person frequently carry a SodaStream bottle? Your person is Colleen.
Hey, Colleen. Okay. Hey, so I saw that patient down in the ED.
So I think it's pretty straightforward. It's a 2-year-old who was playing out on the swing set today and fell and kind of hit the corner of their head on a rock. So we have a pretty deep laceration that's probably going to need a couple of sutures.
Okay, honey. So what we're gonna do, we'll go down and get everything together to suture this. But we also want to make sure we get a really detailed family history and make sure the family understands the ethics behind getting anything sutured.
Hey, Tom.
Hello.
So I wanted to take a minute to introduce you to Colleen.
Hi, Tom.
She's one of our senior residents, and she just has a couple quick questions before we get that laceration all sewed up.
All right.
Great.
Okay, thanks, honey. So I just want to ask you a couple of clarifying questions. I understand you and he live in Essex.
Yeah.
Great. And has he had his vaccines?
I think so. Yeah. All regular checkups and everything. So.
Okay, so you should carry around like a little card with all that information.
Okay.
at
All right. Yeah. I'll
times.
check with my wife maybe.
And do you know if you and your wife had all your vaccines?
I think so. Yeah. I never really asked my parents about that, but
Okay. Do you know if you've had chickenpox?
I did have chickenpox when I was little. Yeah.
Okay. Do you know what age you were?
Grade school sometime.
Okay. And how many pox approximately did you have?
I don't know, a bunch, normal amount. Wasn't in the hospital or anything like that.
Okay. And were you sick for a few days?
Yeah.
How long do you think it lasted?
I honestly, I don't know.
Okay. That's really helpful. That gives us a better sense of how we're going to take care of him.
Okay.
So before your family came to America, do you know what ethnicity they were?
Scotch English, I don't know.
And approximately when do you think they came to America? So I understand your family came over on the Mayflower originally?
That's what my family's told me. I don't know if that's actually true. But.
Thanks, honey, for clearing that all up. That's great. Do you know if they had scurvy in that time?
That's a good question. I don't know. I know that was a common problem.
So, do you think your family had smallpox in the past?
I don't know. I guess they probably did at some point.
Okay, good. That's important for us to know for the family history.
Excuse me, Colleen. So I think we're kind of all cleaned off, and I have the suture ready to go. I don't know if we're just about ready to get everything sewed up.
Great, thank you. So, I think we're just about ready to start suturing them up, so we can get you out of here.
Right.
But I just want to talk about the ethics and get formal consent that you understand all of the implications of what we're going to be doing now.
Great.
Okay.
Wait, now she's gonna leave.
Let me open it right now.
Okay.
In Chicago, they taught us to learn the Krebs cycle from the bottom up, which according to some very, very important studies, show that.
Never mind. I'll look it up. I'll look it up. Keep going.
Alright, we're gonna take it again.
Hey, Mark, you can hear that?
Sorry, our bad.
I thought you were. Okay.
No, I'm thinking the first part is the we're just
Dreamer's disease. They got you down on your knees. So polite, your business still say please.
No! Don't put down! Hit! We are fierce competitors. No one can take us this year. Oh, Mitch, you look great, Mom. Mitch, you look great. You can really taste that Kentucky man. Alright, now let's think what I should say.
Scotch English, I don't know.
And approximately when do you think they came to America? They had scurvy in that time?
That's a good question. I don't know. I know that was a common problem.
Do you think that they had scurvy in that time?